Welcome to Little Steps, Big Gains in episode 5 of our series on the treatment of upper limb ataxia compensatory techniques. So far in this series, we've been focusing on remediation, ways to improve upper limb ataxia. Now we're going to transition to compensatory strategies, in other words, ways to offset the problem. We're going to talk through cooling, visually guided techniques, and peripheral manipulations. Cooling-induced tremor reduction. It's a modality that has research. You can find links in the description below to support cooling for ataxia and multiple sclerosis. I have found it beneficial to some and other individuals with cerebellar ataxia, just depends on the type. But to tap into this, you take an ice pack, you put it on the forearm for 10 minutes. That possibly can improve upper limb ataxia. Here are some writing samples of individuals. The first one is an idiopathic onset cerebellar ataxia before and after 10 minutes of icing. Next are spiral samples before and after 10 minutes of icing. And finally, this individual has an essential tremor with spirals before and after 10 minutes of icing. Next, visually guided techniques. Now, as a review, when we do manual aiming manually for a target, that's broken down into 2 phases. Before the phases, the eyes first kick in, jump, and fixate on our target so we know where the heck we're going, right? Phase 1. This comes from the limb, proprioception, a central set of motor commands that tell the limb where to go as it moves its way up. However, it stops short of the target, and phase 2 kicks in, a visually directed phase. The eyes help the limb hone in for accuracy and precision onto the target. So if we have a difficulty fixating our gaze with ocular motor impairments, that's going to contribute to an intention tremor with inaccuracies there. This is why some studies that looked at intention tremors show that the tremor was most pronounced when the visual target and the limb was available. And actually, the intention tremor was less and less pronounced when the target was actually removed with the eyes closed. Here are some applications from the community. When painting, my brain, my eyes, and my muscles can't coordinate where the line should be. Like there is a delay. I almost have to look away to be able to paint on the mark. I've noticed that I close my eyes while eating sometimes. New habit, I guess. And I have a slight tremor in my left arm. I usually don't use the hand or arm because of it. I punched myself numerous times. Interestingly, I close my eyes to do things sometimes, like folding clothes. I always thought it was a muscle memory. Maybe this makes more sense. Now, while closure of the eyes doesn't work for everybody, research shows it can help with some. Now, a few other applications for using visually guided techniques include eye rehearsal training for mobility and a clock turn strategy for turning or pivoting. Rehearsal by eye movement improves visual motor performance in cerebellar patients. This study had 2 cerebellar patients. They walked a sequence of 18 steps. They were monitored before and after a batch of eye movement rehearsals. In other words, what they did is they first just walked. Then the second round before they walked, they stopped and rehearsed the movements, the footfall place with their eyes only. After the eye movement rehearsal, this was accompanied by increased regularity and accuracy of stepping in both patients and decreased stance and double support phase durations. The application would be before you walk, stop, look with your eyes, rehearse the steps first. That can help with that footfall accuracy. Next, we have peripheral manipulations with proximal stabilization and splinting. When it comes to our limbs, we have something called degrees of freedom. It's basically the movement available at each individual joint. So for example, in the arm, we have 7 degrees of freedom. At the shoulder, we have flexion, extension. We have horizontal abduction and adduction. Internal and external rotation. We make our way down to the elbow. We have flexion, extension. We have pronation and supination. We have wrist, ulnar radial deviation, and wrist flexion and extension. That's a lot of degrees of freedom, a lot of joints to coordinate. So if we do a functional task, we can reduce that lack of coordination by taking away the degrees of freedom, stabilizing proximally, maybe eating with that arm at the side, maybe putting on lipstick, use both hands centrally, brushing the teeth. Here's a picture on the left of an individual brushing her teeth. You can see all the degrees of freedom required for that movement. However, on the right, if I go ahead and I push myself against the wall, use the wall to stabilize my arm, and then an electric toothbrush, I have completely removed almost all the degrees of freedom required to brush my teeth. Another route of proximal stabilization for some people is to use a wrist brace with certain activities like writing or eating. This particular patient found a lot of improvement in their writing. As you can see, the first line was without a brace and the second line was with a brace. A clack turn strategy. There's evidence to support this for Parkinson's disease, but I found it really helpful for ataxia as well. Now, it can be very difficult to turn and pivot. It involves the eyes, saccades, dynamic visual acuity, and the limbs, knowing the footfall placement while we're turning and coordinating one foot at a time. So we can simplify this by using a clock turn strategy. To do that, one foot stays planted in the middle. The second foot is the one that's responsible for moving. So it just steps, 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 and maybe even rehearse mentally or physically, if you want to do that eye rehearsal training, the numbers of a clock. That can really help simplify this whole task of turning. So a functional application is if an individual is going into their closet to grab a shirt. Walk up, they grab the shirt, and then when they want to do that 180-degree turn, if you're using both feet, it's like a step, 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 step. If we use a clock turn strategy, we just keep one foot planted and only move the other foot into a clock direction, and then we walk. That can really simplify this whole task of turning. In conclusion, when it comes time for compensatory strategies with upper limb ataxia, ways to offset our problem, we can try a few things. Try cooling induced tremor reduction. Research is linked below. Try visually guided techniques. Maybe remove the visual target. Maybe practice doing the eye movements and then the hand movements. Maybe try eye rehearsal training with walking, that clock turn strategy. And then proximal stabilization, removing the degrees of freedom, trying wrist splints, all sorts of avenues. Those are a few ideas that might help. If you found this particular video educational or helpful, please press that like, subscribe, share these free resources with others. My link to Patreon is in that description below. And then check out, we have one more follow-up episode in this series looking at adapted equipment and activity modifications. And then check out other free educational videos and free home exercise programs here on Little Steps, Big Gains.